So I wanted to talk a little bit today about how you can do some self-care for wrist pain, elbow pain, hand pain, all of the things that we're starting to experience because we are now working from home and working in different ergonomics. I'm getting a lot of clients that are asking for self-care treatments while they're waiting to come back into session here at the studio. So one thing that we really recommend, I'm going to actually kind of take you through what I do personally. So our bicep, the main muscles that we're going to treat are going to be the bicep, thinking about our position, at a computer. So the bicep is tightened and contracted. We're using all of our forearm extensors and our flexors quite a bit with using our fingers or digits. And then all of those tendons run down into the hand and help to move those fingers. So we also, with a lot of scrolling with social media or just being on your phone or device, a lot of our thumb muscles are starting to get really sore, and actually the text thumb is becoming a thing. So the way that I treat is pretty easy. What you want to do is take your opposite hand and kind of cup your fingers, and you're going to look for, the bicep has two heads, two sections, an outer and an inner. And you want to look for kind of that belly of the muscle. You can kind of move your arm up and down a little bit to contract the muscle so you can find it. Now, if you feel an electric shock sensation, which is a nerve, move off of that. If you feel a pulse, which is your artery and veins that run through the arm, move off of that, please. Make sure you're on a muscle. So just kind of grab it. You can kind of pinch it a little bit and pinch that muscle and kind of pump the arm a little bit. You can rotate gently. You don't want to do a lot of shoulder rotation, but just kind of rotate gently right here. And then on the inside. And then as far as the forearm muscles go, we have the extensors here. Again, kind of cupping your fingers. You'll be able to find those tendons. You can kind of flip over them. They're usually really, really tight, especially if you're doing a lot of computer work. And you can contract those muscles, bring your wrist and your fingers up, and then rotate the lower arm back and forth and kind of flip over those. You can go all the way down. And then I'm also kind of doubly treating because as I'm doing this on the top, I'm also using my thumb to get the flexor muscles on the other side, the ones that bring your fingers in. And use movement. Movement is your friend here. So if I were just to do this, my hand would kind of tire out. If I'm using the movement and using the tissue against my fingers, sometimes I can get deeper and it's a little bit more effective. And I always just kind of like to do a little squeeze and do kind of that same thing on the tendons on the wrist. You have lots of bones in the wrist, the carpal bones. So it's kind of nice to just do some circles there and some friction. And then I just kind of gently pull on my fingers. Sometimes there will be an adjustment. We don't ever really expect that to happen, but if you've been typing like this, sometimes there will be. And then I just take my thumb and my opposite thumb and see if I can show you. And I just kind of go from the base of the thumb up to the base of the I guess the wrist to the base of the thumb. It's that meaty part of your palm. Just kind of do that. And then again, movement. You can move your thumb around a little bit. Or you can grab it like this, right? Like do some circles, find a nice trigger point. And then another really cool thing is, this web, there actually is a muscle in between here. If you've ever pinched that, it's really, really sensitive. But kind of take your finger and your thumb in between, and don't pinch too hard. But that's just to show you where the muscle is. And then you can kind of take your finger and kind of dig on the inside for that tendon attachment of that muscle. And then on the opposite side, at the base of the index finger. And that should give you some good relief. And then the last muscle, this is the one that always surprises people in session. The brachioradialis muscle attaches on the outside of the elbow and then runs to the outside. If we're in anatomical position, it would be the outside of the lateral side of the wrist. And this muscle, in massage school, they always called it the beer drinking muscle because, think of a beer stein, right? Putting the wrist in this motion, flexing in this motion is what tightens that. This is the muscle that usually surprises everybody in session. I hit this and they're like, whoa, that's so tight and so tender. So feel free to do this to yourself because it's very beneficial. But what you can do is you can just put a little bit of pressure right there in that corner on the elbow. And if you want to test it, you can see where that muscle pops up. Take a couple really good deep breaths. And you're good to go. Now, as far as stretches go, a previous video I had showed you the stretch for the bicep where you're, against a door jamb, turning your torso, your belly button away with your arm extended. That will stretch the pecs and then into the bicep. Stretching the forearm flexors, you'd bring your fingers up. Make sure your arm is in kind of a neutral position, and some fingers are going to be tighter than others, so that's okay. That's just where your body is in a given day. And then extensors, this is the one that I really love to do. So I start in a neutral position, okay, and then I actually rotate my elbow out. So let's see if I can show you guys. So I'm here, this is neutral, and then I rotate out, and that gets these bunch of muscles down here, and then that brachioradialis. So make sure you're doing both sides. And it'll feel kind of like a burning sensation in the very beginning. Don't overstretch, just kind of meet that discomfort, and then take a couple breaths in, and then you can release it. And then the other side, and then roll out, and you're good to go. So that should help you, a little bit of my self-treating. And then I would also piggyback this with, in addition to the pec stretches that I showed you against the wall, I would also do the lat foam rolling that I demoed in an earlier video, and I would also do the tennis ball against the wall with the rhomboid in the scapula area, which I demoed as well in another video. So if you're not already on my YouTube channel, subscribe so that anytime I put up a video with either just myself or my team or our experts, our expert interviews, that you can have that information right away. So have a great day. Be healthy, be well, and for those that are clients, we're looking forward to seeing you again whenever we're able to reopen, and we hope that's very, very soon. But until then, stay safe and have a great day.